So thyroid cytology. So normally we all know the thyroid when you consider thyroid gland, thyroid cells. So this is it's contain thyroid follicle, follicular cells, colloid. Uh, these are the main parts we can observe. So FNAC has become a first line investigation uh, for the diagnosis of thyroid lesions. So best choice is FNAC for the thyroid lesions, right? And benign and the malignant condition of the thyroid gland can be safely diagnosed by FNAC technique in many of the occasions. So these characteristic uh, cytological features that are taken in consideration when making a diagnosis. So uh, when we go to the colloid goiter, so here the smear shows abundant colloid material and the stain smear showed uh, colloid as a thick eosinophilic material with many bare nuclei and formally cells, and also follicular cells with fibrillary cytoplasm. So here you can see the picture. Follicular cells are seen in sheet or in a form of small ring-like. And uh, only cells and the nucleate debris due to the degenerative changes. So when we consider next is the Hashimoto thyroiditis, the fine needle aspiration smear from the Hashimoto thyroiditis characteristically show many lymphoid cell in the background. So previously what we observed eosinophilic backgrounds. Here lymphoid cells are high. There are cluster of follicular cells infiltrated by lymphoid cells and multinucleated giant cells may be present. Heltal cells changes may be prominent or not. So this is the special cells you can see in the thyroid glands. So when you look at the uh, Hackle cells, this is monomorphous cells population. So arrangement loosely cohesive cluster and single. These when we consider the cell shape polyhedral. So when we consider the cytoplasm, cytoplasm is abundant and granular, well-defined cell borders. Uh, nuclei it is enlarged and macronucleolus at the center it's prominent. Right here you can see Hashimoto thyroiditis. So follicle cells are atrophied and show no colloid. And here you can see is the follicle lined by um, follicle lined by um, Hattel cells and also in sheath like. And other thing, lymphoid follicle with uh, germinal center formation. So from its center, uh, germinal center is present, so it's automatically produced. So next one is the papillary carcinoma of thyroid. So here various architecture patterns seen in papillary carcinoma are as follows. One is uh, papillary fronds with a complex branching configuration. Second one is the monolayer sheet with the crowding of cells, indistinguished cells membrane and loss of polarity. Third one is the syncytial type tissues, fragment with or without a microfollicular petals. So the picture is here. So next one is the papillary carcinoma of thyroid. So nuclear feature, when we consider the nuclear feature, intranuclear cytoplasmic inclusions you can see in. So here you can see vacuole-like things, and other thing finely and evenly granular, dusty, uh, powdery chromatin. So here you can see the nucleus, right? Nuclear overlapping you can see in the papillary carcinoma of thyroid, and other one is the longitudinal nuclear grooves you can see. Next one is enlarged nuclei and nuclear membrane convolutions, and micronuclei also you can see. This is the papillary thyroid carcinoma. The papillary formation, first picture explains. Second one is the crowded overlapping nuclei, here you can see. Then next picture is semoma bodies you can see. Then margination of chromatin you can see. Center clearing, margination of chromatin. The chromatins are the outer the edges, viscose edges of the things. And other one, nuclear pseudo inclusion you can see, and other thing you can see nuclear grooves in papillary carcinoma. And other one is the follicular adenoma. Follicular adenoma you can see cellularity is in increases. So here you can see the picture. Uh, Syncytial type tissue fragmented with or without a follicular pattern. So when we consider nuclear features, round enlarged nucleus, smooth outlining. Actually, this picture explaining the tissue, right? Not a single cell. So if it is enlarged one, yes, you can see very clearly, and uniformly increased nuclear features. Other one, evenly dispersed the granular chromatin, and nucleoli absence. So when we consider nucleoli, normally it is absent, but if it is present, very smaller and indistinguished, and sometimes you can see the macronucleoli, right, are not seen. So here the thing is, normally nuclei is not present. If it is present, smaller and indistinguished, but you cannot see the macronuclei. Follicular adenoma additional feature, scanty colloid, usually seen within the follicle, not in the background. So inside the follicle we can see the scanty colloid, right, but not in the background. Architectural pattern, so syncytial type tissues, so here fragmented with a microfollicular pattern. So when we consider the folate cell, uh, follicles are irregular in shape and the size. There are dispersed cells in the background. So when we consider the nuclear features, so crowding and overlapping is conspicuous. The round nuclei show moderate to marked enlargement and a varying degree of the pleomorphism. The size is different, right? And there is uneven distribution of core and granular chromatin. So chromatins are uneven distribution, core and granular, right? And when we consider the nucleoli, so it is single or multiple. Macronuclei are always present, and macro if the macro uh, nucleoli are present, confirm the diagnosis. So it is confirm the diagnosis, right? So next one is the medullary carcinoma of thyroid. So the smear uh, are usually cellular. In the classical form, the cells are cuboidal to polygonal in shape. So the cells are arranged characteristically in a dispersed manner with a few loosely cohesive cell clusters. So when we consider the cytoplasm, so these dispersed cells show well-defined cytoplasmic borders. So the cells have the cytoplasmic border. Right? Then the nuclei are round and pleomorphic, but normally it's round. The size are vary, may be eccentrically situated, imparting a plasmacytoid appearance. You can see the chromatin is coarsely stippled, and nuclei are not visible normally, and well defined and gray blue cytoplasm in the staining smear. Deposit of amyloid which appear as a dense and magenta colored amorphous material. So here you can see the pictures. So when we consider the background, dark background is otherwise clear, right? Normally clear. So these are the references